everybody. So another of our live events. Tammy will join us in just a few minutes. So today's topic is going to be about health issues. So we're going to talk about vaccinations, viruses, parvo, canine herpes virus, brucellosis, going to the vet, intestinal parasites, worms, ear infections, skin conditions. All of these things are going to be what we're going to talk about. And we've got about an hour to talk about this. So the format's going to be, if you've got questions, you can start asking them. I'm going to start talking about particular topics. Remember that I'm not a vet, and Tammy, who will be here in a few minutes, she's not a vet either. But we have been doing this for an awfully long time, and so we've come across a lot of these issues over the last 30 years. So, you know, any time that anybody gives you advice, James, Tammy, a vet, things you read on the internet, I say, you know, I have a thing called my bullshit detector. I have a little bell that goes off in my head that says, I don't think that sounds quite right. I'm going to double check it. So anytime you're not sure about something, I think it makes sense to go get a second source just to back up what you're hearing, to make sure that, you know, the opinions that are being given make sense. You know, we're not going to try and steer you wrong. Don't get, you know, obviously the whole intent here is to, you know, for us to find things out and to educate other people so that you don't make mistakes and make life easier and have more fun raising dogs. That's the purpose of this. But that doesn't mean that we get everything right, and we could occasionally give bad advice. Not our intent, but just remember, don't hold us liable for that because we're not vets, and all this information is free for you to use as you see fit. Okay, so let's get rolling with this. Well, the first thing, I'd like to know how people find out about this particular live, because I did something different on this one. My breeder supply has a pretty good list of customers, and I did email those customers, inviting them to the live show. So I'd like to find out, you know, if people came here through the email invite that they got today, let me know that. That'd be nice to know, because we'd like to know whether or not we're annoying people or whether or not this is going to be useful for them. And then the other one is there's others of you who just know about us through YouTube, and we'd like to know if that's the way that you found us. Maybe you're a subscriber or you just found it on YouTube. We'd like to know that because it helps us decide how we should be getting these live events together. And also, you know, if you've got particular things you'd like to talk about in other events, then let us know that, and we'll start talking about those. But remember, today's topic is basically health issues with dogs. Okay, so let's have a look here. So we've got someone from Minnesota, and we've got somebody here from Great Danes. Brifford from Great Danes has joined us. We've got a few people coming in, which is great. Somebody's asked a question here. Well, I'm going to start off by talking about this. Let's talk about going to the vet. So, look, vets, there's times when you absolutely need a vet's help. Specifically, if you've got a problem and you're worried about it, especially if you've got a dog that's going downhill quickly, obviously it makes sense to go to the vet. But here are the things that I think make sense. And here comes Tammy.
Sneak up on him and scare him.
Yeah, come on in here, hon.
Okay.
We're sharing one microphone today, so hopefully, I think this will pick you up.
Yeah.
So if people can hear Tammy, they might mention it. Okay, so, Tammy, we just kind of, the preamble, we haven't missed much. But we're talking about now.
Oh, I got a cramp in my foot.
Specifically about going to the vet. So I just want to make a comment here. Look, there's great times to go to the vet, and vets are not to be discounted. But there are things that you want to watch out for when you go to the vet. And then remember, I think the one takeaway on this, and we've learnt this the bad way, is that sick animals go to the vet. And it's very likely that there are sick animals in the vet when you go there, or have been there that day. I'm going to tell you a very brief story about a situation we had with labs many, many years ago. We went to the vet's office. About 30 years ago.
When we used to raise labs.
We used to raise labs.
A long time ago.
And we put a litter of labs, I think there was 10 labs that were going there for health checks. And there was a dog in there that had got parvo we didn't know about. And we found out about that not shortly after we walked into the place. We immediately left. Every puppy that we had got parvo. It was horrible. It was just horrible. We'll talk more about parvo later on, about how you can fix parvo if it happens to you. Yeah. But the point here is, remember, when you go into the door, that's the place that everybody before you touched. I think it makes sense to...
When you handle the handle...
What do you do?
When you open the handle to the door,
yep.
You're touching it, you've got them holding their puppy or their dog that has this parvo or whatever disease they have. You get that on your hands. and you get it on your shoes if the dog threw up and it's on the floor or whatever. And, you know, our first instinct when we walked in with the puppies, we had them in a towel holding them. And when we were told, I said, what's wrong with those people that are in there? They're crying because this is a place where I used to work at a long time ago. And she goes, oh, their dog has parvo. And I mean, James and I both went and took the towels and wrapped them up like this.
Too late.
That was going to help, and we ran home.
Yeah, too late. Yep. Yep.
Did the bleach thing.
You look like you've got a really small head today. Move forward here a little bit. So that you're,
I don't like going up there.
There we go. Move this forward.
Okay.
We're going to get Tammy's head so she's got a regular sized head.
Honey,
There
it's
you
because
are.
you've got a big head.
I know, I do have a big head. All right, so the point here is just to do the necessary precautions that you can, just remembering that it makes sense to, you know, when you've handled a door, to wipe your hands with the handy wipes. If you're putting your dogs on a table where other dogs have been, ask that it's be wiped off with some disinfectant, or bring some disinfectant with you.
This is what I do. If it's puppies I bring them in a crate. I leave them in the car. I call or I go in and say, let me know. I'll be out in my car with my puppies, and just let me know. And so when I get to come in, I go straight into the office, and I have a pee pad that I lay that pee pad out on that table. I know my vet cleans it off, but in my mind, I want to do as much as I can.
And one of the things that we always see is we walk into the vet's office and there's people in there and they see the little puppies like, oh, what beautiful puppies, can we see your puppies?
No.
And the answer to that is we don't want our dogs to have any contact with any other dogs because it's always a bit sketchy when they're this young. So, you know, we'll talk about the dogs.
Yeah. But anyway, I take that pad, the puppies lay on it, get checked. Then I throw that pad away because I don't want to put it back in my car.
So here we go, let's get started here.
Okay.
So Tori Caro Flog says, hello, what can I do when puppies have diarrhea? So let's talk about diarrhea. Diarrhea is a good subject because it's something you're going to face, right?
Probiotics first.
So
It depends on how far along your diarrhea is gone.
Tammy gives this to her older dogs and the younger dogs, especially if they show any kind of...
puppies. You can give it to them every day if you want to, probiotics.
I'm not as hot on the probiotics as Tammy is, but here's my thoughts on it. It can't do any harm.
No, and if it's, you just get a first clue that they've got a strange looking mess, give it to them. If it straightens it up, boy, you got that bacterial out of their gut.
So here are the things that you definitely should be doing. You need to routinely worm puppies, and that means that puppies should be wormed at
every 2 weeks.
That's right. Every 2 weeks until they leave.
Until they leave their home.
Start off a parental pale-mate at 2 weeks and 4 weeks, and then switch to safeguard at 6, 8, 10, 12 weeks. And it makes sense to also worm mum 7 days or 10 days before she has puppies.
Cleaning them up.
Yeah, mummy's got parasites. She's got parasites under control. You don't know they're there, but they're there. And she'll pass them off in her milk, in her feces. So try to knock those out by giving mum safeguard at 10 days for 3 days prior to whelp, and then start that again 7 days after for 3 days. So basically your day 10 before and 10 day after that you've wormed it 3 times, twice, for the first week beforehand and the first week afterwards. You can buy it, you don't have to have a script. Yeah, it's a goat wormer medication. You can buy it at your local supply place. You don't have to have a script for it. The parental pale-mate is also called Nemex.
Make sure you weigh your mama dog and the babies before you give
use the right dosage. Check the dosage, do the right dosage. And it's very forgiving stuff. I mean, I've never heard of anybody causing problems with a dog with either safeguard or parental pale-mate. I mean, I guess you could give them a ridiculous amount, but I mean, I think you'd have to give them, you have to almost drop the bottle on their head, I think. It's really safe stuff. But yeah, so that is so if you've got a dog, so here we've got puppies that have diarrhea. If you haven't wormed them, worm them. If they're over 6 weeks or older and they're getting some diarrhea, I'd give them an extra dose of safeguard. If that doesn't fix the problem, then there are a number of things that can cause problems. Giardia, coccidia, and generally worms. So let's talk about those 3 things.
Okay, if you still have a problem, you want to keep your babies at home, you can take a stool sample in a baggie and take it to the vet. You know, write the name on what litter it is, you know, what mama's name is. If your vet knows your female by name, say Phoebe's litter, and take that in there and they'll check it, because if one's got it, they're all going to get it.
That's right, treat the whole lot.
Them all.
Treat the whole lot.
So
what does the vet do?
Our vet does
What does the vet do?
Lets us do that. There's probably going to be some vets that say, oh no, you need to bring it in, and it's like, try to explain to the vet or to the front desk person to say, hey, I don't want to bring them in because I don't want to infect the rest of the puppies. So if they'll let you bring in a stool sample, great, because then they can check it and they'll let you know.
And you don't want to bring it in because you don't want to have an exam done on all the dogs at $100 charge per dog either. If one's got it, you treat the whole lot. So let's talk about specifically.
But you need to let the medicine at least get a little chance to work.
Yes, absolutely.
Yeah.
So Tammy's talking about taking stool sample in. What you do is you find the one that looks the most awful of the whole lot, the one that's runny, the one that's foamy, the one that's mucousy, the one that's
bit of blood in it.
bloody. That's the one you take a teaspoon. Tammy will take his teaspoon, scoop up a steamful plastic spoon, put it in. You don't want that back. At least I don't think we want it back.
No.
Put it into a plastic bag. Give it to the vet.
Ziploc bag.
They will do what's called a fecal flotation. What they do is they
Don't
put.
let it get hot on the way there.
Yeah. You want fresh poop.
Yeah.
Fresh poop, fresh as possible. They're going to do what's called a fecal flotation. What they do is they take that, mix it up with something like Epsom salts in kind of a slurry, put it into like the equivalent of what looks like a shot glass, and everything floats up to the surface. They put a slide on top of the glass. That then collects on the microscope slide. They stain it, look under a microscope, and they're looking for whatever the parasite, the protozoa is causing the problem. So what might those be? So Giardia, very common.
A simple little thing to treat if you catch it early. If you let it go for a long time, you've got problems.
You can lose a puppy with Giardia. What happens is they get a huge infestation, they get diarrhea, they get dehydrated, they're not getting nourished, and they then go downhill. So typically you don't see these kind of problems if puppies have had enough time to incubate the parasite, which is typically 8 to 10 days at least before you start seeing signs of this. But the treatment for that would be metronidazole. It's a standard treatment for that. It's an antibiotic. You do have to get that from your vet, and you typically treat that for 8 to 10 days. And it's a bit rough on them, so you'd like to find out if that's the problem before you just summarily start giving drugs. I don't like this idea about just saying, oh, I've got these drugs around, I'm just going to give these drugs. You'd like to find out what the problem is.
You want to know what you're going to treat it for so it can be treated correctly.
Right, so there's Giardia.
Yeah.
It's hard to detect Giardia. It's a pretty small protozoa. Coccidia, very common. Same thing. Fecal flotal. Look at the feces under a
Same
microscope.
thing. If you let it go for a long time, you're going to have problems.
Typically,
so as soon as you see diarrhea, treat it immediately.
Yes. Or find out what it is, then treat it.
On
yes.
puppies, yeah,
so what's
for
the
sure.
treatment for that? It would be Albon. Is the normal treatment for that. Again, you have to get that from your vet.
And you've got to give that like 5 days.
Yeah, at least 5
Yeah.
days. Both of these at least 5 days.
7 to, yeah.
Yeah, there is a
5 to
product
7 days, yeah.
called Terotrazil, which is actually used for horses, an off-label use. You can buy that yourself on Amazon. It's from horserace.com. And that is a kind of a preventive cure for coccidia, and we do that. We give that to puppies at 2 weeks and 4 weeks. And hopefully that stops the coccidia in its tracks. You never have a problem with it.
Yeah.
Okay, so that's quite a bit about, well, then there's general worms. So there's, if you look at, there's specific products for specific worms. The Safeguard I talked about is a general kind of dewormer, and it'll get rid of hookworms and roundworms, but it's not the best thing for all kinds of worms.
Hookworms you don't want.
No, there are other.
That gets in your yard and
Yep.
it's awful.
But
is Giardia.
these things are detectable,
Not like
and again, if you treated them for 3 days with Safeguard, it hasn't done any good. It's time to go to the vet and find out what the hell's going on. All right. Okay.
Always keep a good relationship with your vet.
Here's somebody's give a good thing here. They said diarrhea, pumpkin.
Oh yeah,
Yes.
pumpkin. Yeah,
Yes.
that's great.
Why pumpkin,
Yeah.
Tammy?
Because the ingredients inside a pumpkin that helps it.
Well, it's got a lot of fiber in it.
Yeah.
So what it does is, one of the problems you have with diarrhea, the big problem is dehydration of a puppy. The nourishment it's taking in just goes right out the other end as a squirt. Doesn't have time to absorb it. What you want to do is slow up that process so the gut has a chance to absorb the nourishments. And what pumpkin does is it makes the poo less runny, more solid, and more chance for them to absorb nutrients. So it's a very safe way to help with diarrhea. And you just do is put some on your finger for little puppies, and just canned pumpkin, nothing special, no brand.
If they're little bitty.
Yeah, a little bitty,
babies,
just a little bit, just put it in their mouth, a little bitty. If you've got a bigger dog, you can give them a spoonful of it. But pumpkin's a great thing.
Probably
So
love
that's
it. The bigger dogs
yeah, absolutely, yes,
lap that right up.
yes. Somebody asked
I
about.
couldn't think of fiber a while ago to save my life.
Someone asked about parental. Yes, parental Paomate is the same as Nemex 2, so that's a good treatment for generally for.
And it's cheaper than Nemex 2.
Oh yeah, you can buy a quart
I
jug
just
of it.
prefer to do Nemex 2 myself.
Yeah, but Nemex, a bottle
I'm
of
a
Nemex.
stickler for.
Nemex, you got to buy it at the vet. Costs you $100 for a small bottle. Well, I say a
You
pint
use
bottle.
very little though.
Yeah, but you can buy parental. It's exactly the same thing. A quart of it might cost you $20 on
I
Amazon.
know, but that's if you're
Well, each
doing
their
a
own.
whole bunch of litters.
Each their own. Each their own.
So it doesn't get old on you. So always be aware how old your medicine is for the dogs too.
Okay, let's have a look here. Have you ever treated a puppy with coccidia? Well, we just talked about that.
Yeah.
Absolutely, very
Yeah.
common thing. So,
Yeah.
you know, the thing you're going to find is if you just have one litter in your house, chances are is you won't see coccidia.
I remember the first time I saw a puppy with bloody poop. Oh my gosh, I thought, oh, hands down, we've got something more horrible like parvo. I thought, oh my gosh, we've got parvo, and I run and take that stool sample to the vet, and they said, chill out, Tammy, it's coccidia, because it had blood in the stool.
How many puppies have we lost because of diarrhea? Not one.
No.
Not one.
No.
Not a single one.
No.
So this is very controllable. So it's not to say we haven't lost puppies. Of course we have, but we don't lose very many puppies.
If
We've
you're
never
ever in the breeding business, you're going to lose puppies one
but,
way or the other.
But we have never lost a puppy because it's got diarrhea and we didn't treat it. Now we've had some that have been hard to treat. Sometimes, I've had dogs that have come to us from other places that have had things like giardia and they've been fairly hard to get rid of. It takes some time. So that's another thing. When another dog comes into your clan, what do you do?
Quarantine it.
Quarantine it. For how long?
2 weeks.
2 weeks.
2 weeks.
2 weeks.
I know that sounds horrible, but it's 2 weeks. You're going to save your kennel. You're going to save what other dogs or puppies that you've got in the house.
The dog traveled
Yeah.
to you. The dog's not properly vaccinated. The dog got parvo. You don't know it. Then 4 or 5 days later, the parvo exhibits itself. You've already exposed your dog to
Or the puppy
it.
rode it in a travel bag that you don't know that it was wiped out or cleaned out, and it got it from there, or with another puppy that you don't know about.
It went on
that's
ground
traveling with
transport
it.
with 6 other
Ground
dogs,
transport,
and they're sneezing. Yeah.
So, they could pick
You
it
just
up
don't know.
anywhere.
You just don't know.
Anywhere,
You just don't
easy,
know.
yeah.
Right. So absolutely, big dogs, young dogs, quarantine them for 2 weeks before you put them in general circulation to make sure there's
And you'll be
nothing
glad
pops
you
up.
did, because if you ever infect another litter group in your home,
I've seen it happen. Seen it happen.
it's not good.
Seen it happen.
You've got,
Yeah, absolutely. Yes.
let's say you had a litter of 6 or 7 and you brought in a new puppy and let it play with them and then had severe
Yep.
diarrhea. Well, we knew somebody that brought home a new puppy
So 1017.
and it had parvo. Remember that?
Oh, yeah.
They lost the whole litter.
Yeah, right. 1017 French's, who's the one who asked about the coccidia,
Okay.
says has a great vet. Yes, thank you. I'm very scared about coccidia. Look, the thing about all this stuff is have respect for it. Don't be scared, be proactive.
right.
Get yourself, and if you're going to do much of this, it makes sense to have these medications on hand.
Google
Especially
it, read it up. You look at,
every single one of you who's watching, you need, I'm pointing my finger, not trying to be rude here, but every single one of you who's watching, there's 2 things that you absolutely should have in terms of medications, and that is Safeguard and either Nemex2 or parental Paramate, because you're going to use them every time. You're going to use them. Makes no sense not to have them and start treating, and just be proactive, because there's nothing, what do they say? Is it an ounce of prevention is worth a pound of cure,
right,
or
right.
whatever it is, right?
And if you don't understand a disease, you're going to be scared of it.
Sure.
So
Yes.
it's something simple to treat if you're on it immediately.
Yes. So somebody mentioned fish sole here. What they're talking about is there are some things. If metronidazole is what you normally treat giardia with, you can buy fish sole, and we actually do this. There are medications that you can buy that are actually for fish that you don't have to have. They're not FDA approved. You don't have to have a licensed vet prescribe it for you. And I don't think there's anything illegal about you using that on your own vets. But there is fish sole, which is metronidazole. There's fish pen, which is penicillin. There's fish mox, which is amoxicillin. There's fish flex, which is sulfaxin. All of these are exactly the same drugs.
I've been taking it.
Me too.
And I've been okay.
Me too.
But
yeah.
that was because we couldn't just go to the doctor. That was back during COVID.
Right.
And
Do it
now
for
it's-
ourselves, for humans.
yeah.
It comes off the same line. But again, if you're going to use things off-label, just do your own research on this.
Yeah.
But somebody mentioned fish sole, and so I'm going to bring it up that I absolutely agree with you. That's right. Somebody's asking about puppy acne, so now we're going to get on to some skin things.
Oh, but they need to Google how much to give a puppy.
Absolutely.
You need to weigh the dogs.
So one of the
and
problems you've
puppies.
got is if you go buy something like a tablet, a 500 or 250 milligram tablet of fish sole or metronidazole, it's way more than you need. And you've got to learn how to crush that up, divide it up, and give the correct dosage based on the weight of what the drug is for the individual puppies. I've got YouTube videos on this to show you how to do it. But don't just give them a whole tablet. That would be metronidazole.
Or your vet can break it up for you too.
Yeah, your vet was going to tell you. I mean,
Yeah.
if you're going that route, your vet will give you something and tell you exactly what to do. They'll say, you know, halve or quarter these tablets up and give one twice a day or something. If you're going to go the James Chopping, the person who said fish soul route, then you've got to learn how to do this yourself and don't over-med
But
or
like I
under-medicate.
said a while ago, keep a good relationship with your vet.
Absolutely.
They're there to help you
With
when
more than
you
one.
can't
With more than
figure
one
out
vet.
something. Yeah.
More than one vet.
Yeah, we've got five vets that
At
we
least.
use. Yeah.
At least, maybe more, actually. But yes, and we know them all well. They know us by first name basis, and they're great.
We've been doing this for, well, when we first started with labs, that was 30 years ago, and now we've been doing Frenchies for 22 years. 22 years.
Are we that old?
Man, how old we are.
Tell
Well,
me
look
so.
at your hair,
Tell
you're
me.
old.
Oh, I've been white for a long
Only
time.
my hairdresser knows.
We'll have you peel off and we'll find out.
Yeah.
Okay, so somebody's asking about acne. Let's talk about acne. So acne is something that's, you can get it in big dogs, very common to see it in small dogs. What happens is typically you'll see bumps that are showing up typically on their muzzle or on the top of their head. Those are typically the first places they get it. Why? Because this is an infection of the hair follicle, probably because they've been rubbing around on mum.
Looks like a little pimple, doesn't it?
She's got a bit of feces on her, whatever. They get them on their
Or
head.
the puppies accidentally scratch them on top of their head because their little toenails
Right.
are sharp,
Right.
and they get a little infection in it, you know.
Yeah. And so we call that acne, but actually what it is.
Or nursing on mama and her hair is starting to grow out from when they shaved her when she had a C-section, and it's pricking that, and there's sweat and,
Yeah. Yes.
you know, stuff off the mama's.
So let's talk about
breast,
those things.
yeah.
So let's talk just briefly about what you talked about mum. Keep mum clean. Keep the nails short on the puppies so they're not clawing her and causing her discomfort. Use some Vaseline or some lanolin to grease her belly up so that it's a bit slick so that the puppies don't start making her uncomfortable. Because those are the beginning causes of these kind of
Make
infections.
a daily ritual
Right.
of checking her scar and cleaning her.
Clean your puppies up. You can
Yeah.
give puppies a bath. So we'll talk in a
Well,
few
you
seconds
can
about
give
the
them a
bath.
little Wash,
You can wash them out with a wash rag.
Wash rag.
Especially their
bath.
faces and their muzzles and their head.
You can give them spit bath.
You give them a spit bath, right. So then what do you
Baby
do?
wipes, you can use baby wipes
Yeah.
to clean them up.
Right.
Yeah.
So let's talk about shampoo for a second. What shampoo do you use on puppies?
Well, we've got a shampoo that we sell on My Breeder Supply.
Oh, well,
That's
there you
really
go.
good.
Let's
and
plug that.
The smell stays on forever.
Let's plug that.
And then when I've got my little babies, I use
Johnson's Baby,
shampoo,
tearless.
the purple.
Yeah, the
tearless.
tearless stuff. That was
Yeah.
great.
Smells very good too, but
Should-
the other one that we sell a long time.
It's
it
good stuff,
lasts,
yes.
Smells really good.
Yes. So should you bathe your
Makes
puppies?
their coat
Should you
smooth and
bathe
shiny.
your puppies every day?
No.
No. How
No,
often should you do it?
no.
Why should you not? How
Well,
often?
your adult dogs, you know, if you can stand them for 2 weeks, then that's really good. But once a week.
So she got a bath today.
Yeah.
Right. She likes
turns
it.
Once a week.
She likes it. And she's in the house with us and on us and in,
yeah.
you know, laying on our laps, and we don't want a
Well,
stinky
we've
dog.
had wet, rainy weather, and it's been
Right. Right.
kind of.
But don't overdo this. You'll dry the skin out. It's
Oh,
not
yeah.
like you and
Yeah.
me where, you know, you might shampoo your hair 2 or 3
But if
times
you're
a
bathing
week.
a puppy, you've got to make sure they stay warm.
Yes. Put some cotton wool in their ears.
Yes.
Don't get water in their ears.
French Bulldogs' ears are standing up like this and open, so put that cotton ball
If
in there.
if it comes out, put it back in. If they get a bit of water in there,
A new
it's
one.
not the end of the
Try a
world.
new one.
Right, you can always use an ear whack, you know,
Q-tip.
Q-tip, and dry them out afterwards.
But be careful.
Yeah, be careful. Right.
You don't want to go
But-
too deep.
Right.
Just dab
but-
it in there.
Don't get your
If
puppies
your
cold.
fingers are small enough, you can do a
Yeah.
little.
You don't test the water. Don't get it too hot, but have
Oh,
it
yeah.
warm. Have it warm. When you've
And I
finished,
just do mine in we've got a real large sink with the sprayer.
a farmer's sink, right? We
And
pop in that.
smooth, slow and smooth, and
Right.
just warm.
Get them used to it. Some of them are going to freak out when this happens. But get them dry. Get a towel. Get them dry. When it's finished, plonk that puppy or that adult in a towel on somebody's lap for the next 10 minutes. You'd be surprised
If you've
how...
got these fluffies, you need a little blow dryer.
Yeah, be careful with that.
Be careful with that, because you can burn that little skin.
Have your hand there so the hairdryer's going onto
Well,
your
I have
hand.
it on low.
Okay.
But it's warm.
Yes.
But keep that
Keep it
the
moved.
dryer moving all the time.
And have your
not
hand down
on
there as
one
well.
Spot,
Yes,
and
right.
far away from it so it can dry.
So this was a question about acne. So those are the first things. You know, shampoo, if it's really bad, a medicated shampoo. If it's really, really bad, you give amoxicillin or Clavamox. So you can see this progress where they get little bald spots all over their body where the hair has fallen out. It will grow back. But if it gets to be a raging staph infection, it can get out of control. And at that point, then medicated shampoo is not enough. You give antibiotics.
Neosporin's always good to put on it if it gets kind of out of control a little bit.
Yeah, it's okay to kind of, there are sore places, but it's not very good to stop it. It's good to kind of treat it and make it less itchy. But if
maybe it'll go away. But if it doesn't, then you got that other thing.
Okay. All right. So now we're talking about skin things. Somebody's asking about Demodex. So now we're going to go on to other parasites, skin parasites. We talked about acne. There's going to be 4 things we're going to talk about: ear mites, ear yeast, a red mange, and scarpotic mange. So let's talk about the manges first. So the red mange, which I think is you call that Demodex, is something that is a pretty serious thing. And the problem with it is
you can't get it. Humans can't get it.
Can get some of these things.
Well, not.
I don't think
not
so.
red mange.
I don't think so.
Yeah.
Tammy scratches herself every now and then, but I don't think it's flat, is it? But she's not even laughing. She doesn't even think it's funny. The thing about red mange is that this is a problem with the dog's autoimmune system typically. All dogs have a small amount of this on their body. It tends to get a flare-up when dogs get stressed, maybe when they go into heat, maybe when they get moved from one home to another. And what you're supposed to do is let this take care of itself if possible. The first place you will see this typically is on the paws, between the toes, maybe on the eyes. Those are the typical places you'll see it. And if it gets out of control, it can spread to their entire body.
If its parents had it.
There's maybe hereditary link to this too, yeah, exactly. We've never had this, but I can tell you I've seen pictures of dogs that have had it and they can get in really tough shape. So if they are really in tough shape, what do? I think one of the treatments is to give them, there are actually a number of medications that you can give, but one of the ones that's kind of an off-label use is ivermectin. And you do it orally. And you can use ivermectin as a heartwormer, and you can use it as a general skin parasite clear-upper. And the doses you give are different. You give quite a bit more of it if you're treating red mange with it. But if you've got red mange, it's time to go to your vet. Get your vet involved in this, because this is something that now, is it a problem for the other dogs? Probably not, but I would separate that dog
Now,
anyway.
doesn't it start on the legs?
Yeah, typically.
And underneath.
Armpits, legs,
Yeah.
maybe at the eyes,
Yeah.
those kind of places, right?
Yeah.
So there's a different kind of mange, which is a lot less problematic. By the way, the way that you detect red mange is you do a skin scraping. What happens is you go to the vet, they put some mineral, they clip the hair on maybe their forearm, they put some mineral oil on a scalpel blade, and they really viciously scrape the skin until it bleeds. And that makes a kind of a slurry of skin and mineral oil. They look at it under a
They
microscope.
do that with ringworm too. Right?
Ringworm too. Yeah, ringworm is a fungal infection. It's a bit different.
Round, but I mean they do the skin.
Yeah, it's a
scraper,
skin scraper,
too.
yes.
Yeah.
So there's 2 different kinds. There's one that burrows under the skin, which if I remember rightly, that's the mange. And there's another one that's just on the surface, which is much easier to treat. And that one is, and that's sarcopic mange. But there's 2 different versions, and one of them's a lot more serious than the other. And I haven't dealt with it for such a long time. I do have some videos on this, so you can go look at that if you want to, in more detail. All right, so that's talked about the manges. Now let's talk about allergies and ears. So very common in Frenchies to have ear problems.
Like yeast in the ears.
Kit has it right now, doesn't she? We've been treating her for the last...
Hers comes off and on with the yeast in her.
So how do you treat it? So what's the first signs?
The first signs?
Yep.
Them shaking their head.
Shaking the head.
Right. And it sounds almost like a fluid in there. And then...
she might rub her head on the ground, running along the ground, or she's got a red ear where she's been scratching the crap out of it.
Yeah.
If you see your dog's got really red, and they might be inflamed, they might be hot, they might be warm, and if it's localized to the ear, you can bet your bottom dollar it's either yeast or mites.
And it kind of dries the ear too. That's what's weird also.
So there's yeast and mites. So how do you detect it?
Mites, like the cats can give dogs ear mites.
So tell us about Q-tips and what you do with the Q-tip.
You clean their ears out with it first.
And you go down deep in their ear with a Q-tip, don't you?
You're pulling out black
Yes.
That is ear mites.
If you put a Q-tip in there and you wiggle it around, the first thing is the dog is doing this and it kind of almost enjoying it.
Yeah.
Because it's
You have
scratched
to
the
be
edge.
careful when you're doing it because you don't want to go too deep in there.
Right.
Yeah.
But if it comes up black, comes up smelly, then it's time to treat. Now what you can do is look at
Well,
this.
the black is the ear mites.
Yeah, well,
If it's a yellowy, hers is kind of a yellowy color
it's probably yeast, right?
from the yeast.
But you can look at it, if you have a microscope, and if you don't have one, you probably should get one. And what I recommend on a microscope is to go by...
I got one for my birthday one year.
You want to impress with that.
As soon as I opened it, Chanel goes, "Oh, cool." She was about 8 years old. "That's so cool." And I said, "Well, then if you think it's so cool, you can have my birthday present."
So if you buy a microscope, I'd buy a
Not a very
Celestron, makes a whole range of them, and get one that has a 400 magnification with an LCD screen, color screen LCD. You can buy one of those starting about $250 up to about $700. It's absolutely worth having a microscope. But anyway, you can then look at that, what comes out on the Q-tip, you can look on a microscope and you can see whether there's things crawling around, ear mites, or whether it's kind of flaky stuff, it's yeast. And there's two different treatments, but basically what you do, most of these are a two-part treatment where you put a cleaner in there and a dryer in there. And you do that, every other day for a week maybe until the whole thing goes away. So normally fairly easy to fix. If you don't fix it, your dog is going to be very uncomfortable and can actually damage their ears by scraping away their ears. Okay, so that's the ear mites. So now, so we just talked about the acne. Somebody says, should we use coconut oil? I love using it. Sure.
I've heard coconut oil is pretty nice.
Yeah, so let's talk about general allergies now. So allergies can be caused by, well, let's talk
Grass
about,
allergy,
let's talk about what an allergy looks like.
red, their feet swell. But, this also either grass allergy or change your detergent on when you clean their bedding. Those are some things you can try to keep from it. Give them an oatmeal bath, and if that doesn't cure it, then you probably got, or not cure it, but make it feel better.
So there's allergies caused by the environment, which is what Tammy's talking about when she says things like grass, things like your laundry detergent, things like cedar trees.
Cedar trees.
Those are all...
I'm allergic to cedar trees.
Yep.
I never had allergies until I got close around.
One of the things that you can do in those
Until I was
situations
17 years old.
would be a medicated shampoo. Somebody mentions coconut oil, that's great stuff. You can rub that on them, help them. You can do things like aloe vera and things like that. They'll help the redness.
Now, the vet can give you a special shampoo for allergies, too.
But the only way that you're going to fix that kind of an allergy is to remove that allergen from the dog's environment. If it's grass, the dog can't go outside on the grass. If it's cedar trees, then when the pollen's high, the dog shouldn't be going outside. If it's detergent, change the detergent. If it's their food, then you're going to have to change the food. If it's chicken, if it's corn, whatever it is, you're going to have to find out by trying different foods. And it's going to be a challenge, I'm telling you.
You can go do a test on the dog, too, and I think that's pretty expensive.
You can do a test. I think you can do like a prick test like you do with a human being, but they're exposed to a number of different allergens.
There's a shot they can give them for allergies,
Yes,
too. What is
there
that called?
Paraquil, or I forget now, but I mean, there are, again, if you don't fix this fairly quickly and you've tried to eliminate all the things it could be, it's time for a vet visit to find out whether or not this can be treated with some kind of medication.
Yeah.
So, right, and I think some of these things are hereditary and some aren't. So, not got a lot of experience with it, but Kit, as I said, does have, her ears are kind of inflamed, have been, and this is some kind of it might be an allergic reaction,
And
I don't know, but.
One ear.
Yes.
She always, I don't know what it is, weather change for one thing, I think.
Yes.
So, we've had some crazy weather here lately.
Yes, all right. What else will I say about allergies? I think, again, the challenge is to find out what the allergy, it could be a number of things they're allergic to, and you've got to try to eliminate those things and see if it gets better. And one of the things that you can do would be, for instance, for the next 2 weeks, not let your dog go outside, so you can get rid of all the outside stuff out of the equation, and get them on a very bland diet, like, rice.
Chicken.
And boiled chicken.
Well, and then if they're allergic to chicken,
then rice and lamb. Then if that doesn't work, then rice and lamb. But
Yeah.
I mean, rice by itself, I don't think it's going to have an allergic reaction to.
I do
So.
ground rice and lamb on that dog food that we
And I mean, one of the
sell
things you can
also.
do here is, is you can go get those ingredients and mix them up yourself, so you know exactly what you've got there. You know, that's probably the way to go. If you've got a severe allergic reaction, you know, it's a challenge, and you're going to have to spend some time to find out exact. Then you can dial it back when you find out what really is the problem. Okay. So somebody's asking about puppies' chests. So we just.
It's not diseases though.
No, it's not.
Our
So.
topic is diseases this round.
So somebody says here, this is why I don't use Febreze plugins. I specific about candles. I don't want them to be that uncomfortable. Well, yeah, I mean, so
Well, you also need to be aware not to use Lysol and bleach, because the bleach hangs down, the smell. That's where the lungs of the dogs. So you need to be really careful when you throw that bleach out. And
I think it's a great
Lysol.
disinfectant, though. So we do use it. We actually use a product called Wishy Wash.
Yeah, Wishy.
Which is a lot less toxic than bleach. But I think the important thing is whatever you use, you need to make sure you rinse everything down properly.
If you're going to use one or the other, I mean, the bleach you've definitely got to watch out for on how much you use, because you can really
Don't need much of
damage
it.
some lungs.
Yes.
But Lysol, it's probably pretty safe if you let your place be aired, but use that on your floors for cleaning and stuff. But if you got heavy duty cleaning, make sure the dogs are somewhere else while you're cleaning it. Then let them back in.
So people have asked some specific questions about puppies. I'm probably not going to answer those on this one because we're probably not going to have time. Somebody's asking about pigeon chest. They're asking about flat chests.
I think you answered that last.
I did, and maybe you'll do another one of those, but I think they're not really part of this particular conversation, so I'm probably not going to answer those right now, or Tammy's not going to either. But don't sign out. There's still good stuff coming. We talk in some depth about brucellosis on the last one, so I don't want to go into this, other than saying that brucellosis is something that you should definitely be testing your dogs for. You can buy the brucellosis test kits at My Breeder Supply. They're like $12 a test. You do have to draw blood, but within minutes you know whether brucellosis is an issue, because you do not want this.
Okay, it's a sexual transmitted disease that dogs can pass to each other.
Will pass to each other.
And it doesn't have to be through sexual transmitted.
And you won't know the dog's got it.
Yeah, it's another dog licking the water bowl, each other. You know, when you see dogs that are
or mating is a very good cause.
Get a female to tease a male.
Yep.
Make sure you use your own females that you know about.
She's talking now about having two dogs together. If you've got an unknown dog, we never put an unknown dog with any of our dogs. That's why we do artificial inseminations.
We have a teaser.
And we have a separate
female.
When a dog comes to us to be bred, it is housed in a completely separate place. Completely separate.
But they're tested before they're ever.
And they're tested for brucellosis.
Yeah.
The problem with brucellosis is you can't fix it. It's a virus. If a dog has got it, you will then
And
start.
the dog gets pregnant, you will have dead puppies.
Aborted puppies.
Yeah.
Yep.
Or aborted.
Yep.
Yeah.
The dog itself's fine.
Yeah.
It's not going to produce
But
any more
it'll
dogs.
affect your whole kennel.
That's right.
It'll
Wipe your whole
wipe
kennel.
you out.
So be careful of this.
Yeah.
It doesn't make any sense not to test
Google
for
it. Google
Yes.
it up and look at it
Right.
and read it and see what.
It's supposed to be pretty prevalent. The funny thing is that we do test, and it's very, very rare that we ever see it. But I think if you're down in Florida or the south part of the United States, it's a lot more prevalent. We're not there.
But I mean, it can carry on.
So while we're talking about this, let's talk about another one that's not common, but apparently it's in the population quite a bit, and that's CHV1, Canine Herpes virus. So this is another of those sexually transmitted diseases. You'll get aborted puppies or puppies that fail to thrive after maybe a week. You can do a titer for it to find out if your dog's got it. It's not the end of the world. Dogs that have got CHV1, you can treat the CHV1, but it is a virus, but it's only infectious at certain times. So I don't want to spend a lot of time on this. I've got a whole couple of videos just on CHV1. You can go look at those. But be aware of this. Now, there are other things that I think are more relevant, and that one of the ones that's popping up at the moment is influenza.
Yeah.
So there are some strains of influenza.
They'll shut down the pounds and the.
Yes.
You
may be seen
What
as-
do you call those places that you adopt pets from?
Pounds? Well, pet shops, I don't know.
Well, yeah. But
Yeah.
anyway,
Rescue
close to
places.
You can't even go take your dog to doggy school, or because the virus is so bad.
It's killing dogs.
Yeah.
It's killing dogs.
Yeah.
And so what do you do on this? The problem
Keep
is
your dogs home. And make sure you get. There is a vaccination they can take.
there is vaccination. I don't know how available it is, but that's another thing. We're going to talk about vaccinations after this. But the thing here is limit your exposure especially younger dogs, to places where there are other dogs that might be sick. That would be dog parks. That would be taking your dog into PetSmart and, of course, the vet's office. Just limit what's going on.
Not
because
just PetSmart, there's other places.
well, yeah,
that
yeah, absolutely. What I'm getting at, you see people taking little young puppies into Pet Edge, PetSmart, those kind of places. I don't think that's a wise move at all. I mean, you wouldn't take a 2-day-old baby into a well, people do. We wouldn't do that. So, you know, just limit your exposure. But that brings us to vaccinations. You absolutely should be vaccinating your dog. Some of these vaccinations, you're mandated. Rabies shots. You have to have rabies shots.
That flu that we're talking about, adult dogs get it.
They're dying from it.
Yeah.
They're dying from it. Yeah.
Yeah.
So let's talk about vaccination.
Vaccinate.
Rabies.
Sorry. Vaccinate.
When do you have your first rabies shot?
At 15, 16 weeks.
Right. So all puppies should get a
Now,
vaccine.
over in the UK and stuff, they do it different, you know.
Well, they don't have rabies in England, so they don't even do it.
But they have to, yeah.
Uh,
They do. Yeah, they do.
Well, I don't think so, but people in England can chime in on that. But look, that is not the point here. The point here is...
When I got Phoebe, she was already rabied before she came here.
Okay, well, then I guess I'm wrong.
Yeah.
Which is not unusual, right? But I think the important thing here is you need to get your vaccinations. You cannot give a vaccination to get a rabies tag. You have to go get a vet administer that. So that's the only one that we routinely get from our vet, and you get a booster every year after the first one. So do get your rabies shots. You don't want to be in a situation where your dog got rabies, or your dog, worse yet, bit somebody after he got rabies. You don't want any part of any of that. All right. So now there's other things that you want to vaccinate against. So what should you get? The minimum one is a 5-in-1 shot. You get that at 6 weeks, 9 weeks, 12 weeks. Some vets will do it differently. They might do it every 2 weeks. They might do it every...
No, don't do it every 2 weeks. It will not be any good.
Well, so the problem, here's the...
Every 3 weeks, you can let it run up to 4 weeks, but every 3 weeks.
Well, let's talk about
Not 2 weeks.
Why there's some discussion
won't
going
work.
on here. So here's the problem with vaccinations. If you vaccinate too early, they've got resistance they got through mum's colostrum, and so the vaccination doesn't work. If you leave it too late, your puppy is susceptible to nasty things like parvo. So when you do the next shot, the previous shot had to wore off enough that the next shot can elicit a reaction, so they then mount a defense against it. So that's why there's this debate about how often. We do it every 3 weeks, starting at 6 weeks.
That's why we say 6, 9, and 12.
That's what we do, right.
And then 15 if they're still
And I think that most vets would agree with that, but not all vets
will.
will.
Rabies shot.
Right. So what should you give? Well, at the very minimum, 5-in-1, which is, I can't remember all the things that are in there, but it's going to be a distemper, parvo, both very nasty diseases you want no part of, paraflu influenza, crap, I can't remember.
Probably have a little bottle in there to look at.
That's fine, but I mean, so there are 6-in-1s and 7-in-1 shots. So should you get those extra shots? And I think the answer to this is, if you're in a kennel environment, absolutely. If you are going
there's
to...
kennel cough too.
That's Bordetella. Right, I was going to actually talk about that, because it's
yeah.
not part of the normal vaccinations. So that can either be an injection or a nasal spray. And it makes sense. If you are going to...
Anytime you're bored,
there you go.
boarding your dogs.
If you're going to board a dog...
Get a kennel cough.
Yeah, get the Bordetella /
up their nose.
Yeah, get a squirt up the nose. The vet's probably got it there to give to the dog anyway, but I think it makes sense to give that before the dog ever shows up. It's kind of like getting the flu shot, just as you're going to be exposed to flu. You haven't
prevent it, yeah.
Yeah, I think you might be a bit late. But get your dogs vaccinated, and if you're not sure, get the 7-in-1. I don't think there's any reason not to. It's just a few bucks more. And by the way, what we do is we buy 25 shots at a time at places like Allied Vet that will cost around $100 for 25. It's about $4 a shot, $5 a shot. It's not expensive. They're going to sell it to you with the needles. You will have to pay for express overnight shipping that comes in a refrigerated box, because you cannot let these things get warm. If you go buy these from your vet and do it yourself, you need to transport them home.
If it comes to you warm, you better be
Don't use
calling
it.
them up and sending it back.
If the ice is thawed out, don't
Replace
use
it,
it.
yeah.
You need to have this stuff stay cold until you use it. So that means that when you transport it home, it's got to stay cold. Ice packs in a plastic bag for the short trip, or if it's going to be shipped inside a styrofoam box, when you get it, it goes in your fridge. Not your freezer, but your fridge. Okay.
But just remember, your dog is like your baby, and it is your baby you're bringing home. So if you treated your kids, gave them all their vaccinations, you definitely want to give your little puppy dog, all its vaccinations.
So Brianna has asked a question, so I mentioned microscope. What is the best microscope to use to look at semen? Anything with a 400 or higher. If it's got a screen on it, then I like the, I came up with the name and now I'm going to forget, it's Celestron products. If you're not using that, then go buy a good brand name one, a binocular 2-eye piece. If it's not a digital one, a Bausch & Lomb, someone like that. Used ones on eBay, you can buy for not, $100, you can buy a really nice microscope. And then just the same person, what age you start practicing pulling for a male? About 7 months. All right, so let's get on with this stuff. Is re-vaccing for herpes required every single litter if the female's had it before? I don't know, because we've never had it. I don't know. I know that it's one of the things that you do for a litter that maybe you're suspect.
Vet could probably answer that. Too.
Well, I think one of the things that you do is you do a titer on the female to find out whether she's infectious. I don't know what you could, if she's got it, I don't think you can treat her with a vaccination after the fact. You had to have done that before she ever got it. But I might be wrong. That's a vet trip for that one. So 1017 French says, finding a good vet is so important. Mm-hmm. We agree. Mm-hmm. Also learning...
Finding more than one vet is important.
But also learning on your own to watching videos like yours is also very helpful. Exactly right. I mean, look, we think we do a good job at this, but we're not the only game in town. The important thing here is learn about this stuff. Mm-hmm. The more that you can figure stuff out before it becomes a problem, the better chance you have of clipping it in the bud before it develops into something a lot more serious. So, touch wood, we don't have problems, but also we get on top of things really quickly. We do have things like...
It can happen though.
It can. We've got feeding tubes, we've got incubators, we've got oxygen machines, we've got stethoscopes. We've got all these things and we know how to use them so that...
We've got a heated whelping system.
We have a heated whelping system.
Incubator.
Yes, exactly.
Yeah. Try to think of all the what ifs.
So Levi Monte says, once you've done vaccinating at 12 weeks, when do you vaccinate again and do you use the 5-in-1? So
12 weeks, you do it at 15 weeks.
Okay.
You do 6, 9, 12, and 15 weeks.
And you're finished.
15 weeks is when you're done. 15 weeks is also when you can get the rabies shot. And you don't have to go visit your vet till the next year after that and get a booster and
for the rabies.
Get another rabies. No, a booster and a rabies.
Okay.
Yeah.
And then typically...
Every year.
Those are the times that you might do a 7-in-1 because your dog is stronger, bigger, healthier, can handle a multiple vaccine regime. So if you haven't done a 7-in-1, I think it might make sense to do a 7-in-1 at 15 weeks. Oh, the very good important point. My girl was in heat, was up for vaccinations. My vet inquired and said, what?
No, I wouldn't.
You do not vaccinate a pregnant dog, ever.
Oh, okay.
If it's due for its rabies shot, you skip it, you wait till after she's had the puppies. You do not vaccinate a pregnant dog, period. Any vaccinations at all. You likely abort the litter. Do not vaccinate. So if you need to be aware of the fact that if your dog is pregnant, don't go get a vaccination. And if your vet says otherwise, go do some research and tell them that you're not going to do it.
It's your dog.
Yeah, don't.
You can tell them no.
That's another thing here is, by the way, you are not required to take your vet's advice, right? You are required to get rabies shots for your dogs. You are required to have a dog on a leash when it's outside, if it's not in an area. Those are things you're required to do. You are not required to take your vet's advice. And some vets, unfortunately, do, not most,
if you have a gut feeling something's not right and said right, then you can, step out, go to your car, Google it, call somebody.
Come back another day, get a second opinion,
yeah.
whatever. Something else.
If you don't like that answer, then go to a different vet.
Yes. Something else, while we're talking about what you don't give a pregnant dog, is you do not give a pregnant dog steroids. So prednisone and these kind of things, which are fairly common things to give to dogs, those will abort a litter. In fact, that's one way of aborting a litter. You do not give those to a pregnant dog. So just be aware of the fact that, what do we give a pregnant dog? Well, one thing we give a pregnant dog every day is 5 milligrams of folic acid. And we give a quality vitamin too. Other than the worming it gets 10 days before it has puppies, that is all we ever give, unless, well, let's talk about fleas for a second, because that's something we do see. So let's talk about fleas and ticks. So that was something else.
You let fleas get out of hand, you will have roundworms.
You won't have any friends.
You'll have roundworms. There's another worm.
Well, I was going to say tapeworm actually.
Oh, tapeworm.
Tapeworm, but
Yeah, sorry.
but
Yeah,
so
the long stringy one and then
yeah, it
shrinks
comes
back, yeah.
yeah. So
Yeah.
or maybe looks like segments of rice in their poo.
Now, yeah,
Yeah.
that's the worm.
So you can
The
see
flea
that.
is
Yes.
a little,
How do you see the fleas?
yeah, if you're going up against like the grain of the coat of the dog, you're brushing upwards where the hair lays down this way and you're brushing upwards and you see little black specks in there, that is the eggs.
That's when you get an ice pick.
That is the eggs that the fleas leave.
Or the fleas themselves. If
And
they're
then
moving.
the fleas are the little bitty brown thing with the little long legs and
They're so small you
Yeah.
can't make out their legs, but yes.
yeah,
Maybe you can.
Yeah,
Well,
you can.
they're there
It's
one
the little
moment.
eggs.
They're there one
You
moment, then they're
don't
not.
want those eggs on the carpet of your floors or
You don't have any
just on
friends.
your floor.
You don't have any friends who'll be doing this all the time. But
You
seriously
have
though,
a flea outbreak.
so let's talk about. So what?
You
By the
wanna
way,
spray the bedding with we
Adam's
use
flea and tick
Adam's
spray.
flea and tick
Comes in a
spray.
blue bottle.
Spray the bedding with that.
and Mama, on her back, if she's nursing, not on her belly.
Yeah.
Don't recommend.
If
So
she's nursing, you just do a strap right down her back and rub it in.
so
don't-
somebody at the beginning asked about Prevecto, which is a thing that you give dogs.
Yeah, but ingesting through the
So
body,
the
don't
question
do that
was,
one.
should you
Don't
use
do that.
Prevecto on a
Wait
pregnant
till
dog?
after she is through nursing.
I would
She's weaned
exactly.
puppies.
I mean, it
Yeah.
says it's okay.
Yeah, but
I
I can't
wouldn't.
believe it says it's okay.
Well, it does say it's okay. I know that, but here's my thoughts on this. I would give Prevecto to a dog that had a really bad infestation that I couldn't handle by spraying with Adam's flea and tick spray. Otherwise, I wouldn't.
Dishwashing soap will get them off,
Yes.
but like the Adam's flea
And one
spray
way
just-
you will typically see these is in the crotch, under the arms, in
Don't
between
do
the
it under
toes.
the arms on the mama dog, only on the back, because the mama dog's got babies crawling underneath her and around her, and finding a place to nurse, and they're liable to get that, and it could be harmful to them for sure.
Paul Phillips says, vet is mandating that I test my female for heartworm and Lyme disease to do a surgical insemination. Any idea why? No, ask them. I mean, it might be fine, don't get me wrong. To do a test for heartworm, not a problem. I probably wouldn't treat heartworm on a dog that was pregnant. I'd wait till afterwards,
yeah.
depending on how severe I thought it was.
I don't think a vet would treat a dog with heartworm, a pregnant dog.
Well, I mean, they may be saying that they don't want to do an insemination if the dog has heartworm. They want to treat the heartworm. That might also be a reasonable thing to do too. But I think you've got to ask the question why. So I know one of the answers is that you don't.
You want a heartworm afterwards, I think.
Well, yeah, but the question is why is the vet saying, if we're going to do a surgical insemination, I want to do a test for heartworm? And I think the answer is if it comes positive heartworm, they don't want to do the TCI. That would be my guess.
Or
And
maybe they just don't want to do the TCI. period.
well, there's another thing here. There's a lot of vets out there, especially on the east and west coast, that don't like the idea of breeding dogs for whatever reason. And I don't want to have a political debate about this. They have the right to hold back their service. They can say, just like you can put a sign that says, no shoes, no shirt, no service, they can refuse. Just like they can say, if we're going to do a C-section on a dog, we're going to do a spay at the same time. You can also say, we refuse. We're going somewhere else.
Yeah.
They may say, well, if you're not going to let us do that, we're not going to do a C-section on a dog.
different vet.
Go to a different vet. You
Yeah.
can't force them to do this stuff, but you can decide whether you're going to go there and whether you're going to give
That's
them
probably
money.
one of the questions you want to ask your vets when you're checking them out to see who you want to use. When you're checking out your vets to use for C-sections, you want to make sure they've done C-sections on Bulldogs.
Yes.
And you definitely say, and I don't want her spayed until she's ready to be spayed.
Never. There's reasons to spay dogs, but there's never a good. There's the worst time to spay a dog is during a C-section. It's too much load on a dog. You're likely to have failed milk, failed mum, and all kinds of other problems. It's just too much load on a dog. If you're going to spay your dog because it's your last litter, absolutely do that. But just wait. Wait.
Yeah.
You have to do it then. I know there's more
After
money
she's weaned
involved.
puppies, then go
Yeah.
ahead, have it done.
Yeah.
Not before she's.
Tammy and I
weaned
both had
puppies.
each of us had a knee replaced, total knee replacement. Maybe that, you need to have 2 knees replaced. You don't do that at the same time. It's just too hard on a person. You don't do that. You get 1 knee replaced, you come back in a year later and get the other knee replaced. You don't do 2 hips at the same time, and you don't.
Well, remember, French Bulldogs, if they stress
Yes.
something terribly, they're probably going to die.
Blue Faro Kennels, best antibiotic to give a female who's due for heat. Well, there isn't one. I mean, why are you giving an antibiotic? So the reasons that you might give an antibiotic is that you're concerned about things like vaginitis or,
Yeast infection.
well, no, not for yeast infection, because that would be, that's not a bacterial infection. But the point here would be, you've had a history of pyometria, things like that. There may be good reasons that you would give an antibiotic, but I just wouldn't routinely give an antibiotic. Remember, the problem, antibiotics are miracle stuff, but they wipe out a lot of good stuff as well. So you can really change the fauna and flora of a dog's gut by giving an antibiotic. So just to routinely give an antibiotic, typically it's a mistake.
Well, I think it's also hard to get an antibiotic from a vet anymore, like it is.
Maybe. Well, you can go buy, you can buy the fish products and give it yourself. But my point here is, we don't give antibiotics unless there's an obvious reason why we're giving that antibiotic. Was that thunder?
No, that was me moving.
Oh.
Oh.
Happy Girl says, well, let's see this, that's not about, we're not going to deal with that. How long are we doing? Tammy's getting up because we're 55. You getting up because your back's sore?
Yeah.
Oh, okay. 55 minutes into
I'm
this.
old.
55 minutes into this. So we'll just answer this one here. Somebody's asking about x-rays. Are they 100% accurate after 55 days? And so you're expecting to have puppies, you did an x-ray and it was negative. The answer is it should be. It should be. Now, I can tell you stories of people who had x-rays where the vets come back or the technicians come back and said, dog's not pregnant. They don't think they got a puppy, and the next thing you know, in the middle of the night, one puppy pops out.
One or two.
Yep.
There's
So the problem with, so there's three, let's talk about, we're going to tie this up at the end of this because this is kind of the end of it all, but we'll talk about this. So we're going to talk about the probably four ways that you can tell a dog is pregnant. One is it's getting fatter than hell. Nipples are getting big, it's got a milk line, it's obviously pregnant, you obviously bred the dog's pregnant, no doubt about it. Not much point, in my opinion, of doing anything except getting ready for a C-section. Number two is that you did a relaxin test at day 30 or later after the AI. That's a blood test. We sell those tests and it comes up positive. Almost certainly that dog is pregnant. I've never seen a false positive. I've seen false negatives because they're done too early, but never seen a false positive. The next one is you do an ultrasound, typically at day 24 or later. They are, to me, the most unreliable of the whole lot. They certainly can give you some information about how many puppies might be there, but you get lots of false positives where they're seeing things like feces and making the mistake of thinking that's a puppy. So a good ultrasound tech who can see fetal heartbeats is probably okay, but I'm not crazy about that as a technique. So if you're getting, like that customer saying, you're 5 days out from an impending C-section and you're not sure, get an x-ray. Because you do not want to open a dog up that has no puppies inside it. Mm-hmm. And you don't want to not get a C-section and have stuck puppy, trying to be delivered at 3 o'clock in the morning on a Sunday. That's not a good thing at all. So, some people would say, look, I've got one puppy, I could probably get away with it and just have a natural birth. No, probably not. That's probably going to be a late puppy to come out, and it's probably going to be big because it had no competition, it's had all the nourishment in the world. They tend to come out late. They get really large inside the uterus and they get stuck. So an x-ray, if you're not sure, it just makes sense to get an x-ray so that you don't get caught with your pants down. And the story I was telling you about was actually a friend of mine, who's now a friend of mine. He called me up because he'd had an x-ray done. They said there weren't any puppies. And then all of a sudden he had a puppy in the middle of the night and had to go to have an emergency C-section. It was in New York. And I think the cost of that was $6,000 for a dead puppy. And I then got involved with that person, and now they've been breeding dogs with me, and they have not had those problems. But they did before they, so it wasn't my fault, and I was there to help them out to try to avoid that. So you need to make sure that you're getting your timing right for C-sections, and you need to make sure you're C-sectioning on the right day, and that you're doing C-sections when they need to be done, which is whenever a French is pregnant. All right, that is an hour's worth.
I got something to say.
Oh, good.
I still have puppies for sale. And
Okay.
I know where some more puppies are for sale. Full fluffies, fluffy carriers. Please give me a call, 580-799-1910, and get your little puppy.
Oh, and I'm going to say one more thing about that. Is there a girl left in that litter?
Uh-huh.
So when we produce a girl, this is actually, God, brain dead. Ken and what's her name? Shelley Bowles. Shelley's puppies. Because she bred Amanda, one of our dogs. Mm-hmm. When you produce a puppy, from one of our stud dogs, and it's a female, it gets half price breedings for the future of that puppy, whether you keep it or sell it. So that female is entitled to half price breedings to any of our studs forever.
Yep.
It's a pretty good deal.
Yep.
It's Cody's
Even
deal.
Cody's litter too.
Yes.
Litters that he
Cody's got a
has.
litter as well.
Yeah.
Cody can
He's
litter.
got 2 litters.
Yes, we don't have any of our own, but we've got ones
Yeah,
that we're
we
involved.
kinda do with
Well, we kind of
Sherry.
do. We kind of
Yeah,
do. You kind of
yeah,
do, exactly.
yeah.
We're, you know, we need
So we got 1 female left in that group.
right, and a couple of
with,
boys. Really pretty
3
puppies.
3 boys.
3 boys. Okay, that was
2
a big
full
lift.
fluffies.
Yes.
Beautiful Harlequin tweed merle boy, and another little merle boy, and another fluffy carrier boy, or only 1 fluffy carrier boy to the 2 full fluffy boys. So.
Can I do a plug for myself now that you've done a plug for your puppies?
No, I'm not done. I think Cody's got all fluffy carriers, and I think he's got a full fluffy also. So
He's got nice dogs.
remember my phone number to call me, and I can tell you even FaceTime.
FaceTime.
580-799-1910.
Trying to make my head look the same size as your head.
Sorry.
Well, I'll give you one more plug to you. When you get one of our puppies, we're here for the long haul for you, by the way. This is not just about a puppy just leaving us.
Yeah.
We're going to follow up on that puppy. There's going to be questions about that
We help
puppy's develops.
mentor you
We're going to
with
mentor
those
you if
puppies.
you want to do some breedings. We're going to
Right.
help you with it, even if
We
you don't use one of our
take
studs.
your money and say, go
Yeah.
away, leave us alone.
We care about
We're
where our
here
dogs.
to-
We care
Yeah.
about where our dogs go.
We want to
Right.
see our puppies be successful.
That's right.
along with
Yes.
you.
So my plug is I do have a channel called breeder101.com. And in that, you can go there and there are a bunch of videos. You do have to pay for them. They're not expensive, typically about the cost of a vet visit or less. And these are videos they're not things that I put on YouTube. They're specific to a particular topic, like maybe the secrets of selling puppies. And you get 20 or 30 hours worth of videos getting into this, the nitty gritty down the dirt. Lots and lots of things that Tammy and I have learned over the last 35 years of doing this. So there's some on puppy health, there's some on whelping, there's some on marketing puppies. Just an example, breeder101.com. Take a look at it. Everything comes with a money-back guarantee. You don't have to download anything. These are all streaming videos. You can watch them while you're in the car waiting to pick up the kids or soaking in the tub. And once you get one, you own it forever. You don't have to consume it right away. You can consume it over the next year if you want to.
And I'm going to say another one.
Oh, dear.
All our studs on mybreedersupply.com. MBS studs is where you find it on the menu. All those studs are on specials right now. So
Yes.
we've got several boys. The 3 new boys aren't ready yet.
They will be soon.
They're almost there. About another month, they should be starting to
And
work.
he's got
Somebody-
13 dogs that have been performing for the last.
So we're running great specials.
yeah.
Check that out.
Yes.
And,
And mybreedersupply.com.
yeah.
Incubators,
Yeah.
test kits, progesterone machines. Anyway, there we go. Thanks for watching, and we appreciate you spending an hour with us. And we'll do another one hopefully in a bit. And I see people dropping off like crazy, so I know we're talking too much. Bye. See you. Bye, Tammy.
Bye.